stated, if I am elected and I go to Washington, I will support a vote for the repeal of the current health care bill and look to work to start to replace it with meaningful objectives that can help us do the first and most important thing we should have done from the first place, which is to work to control health care costs. Look, there was no real dialogue in Congress during the period. This is one of the problems of one-party rule. And one of the problems that we had when Nancy Pelosi fashioned together a bill in the midnight hours and said, pass it, we'll figure out what's in it. Well, now we know what's in it. And we can appreciate the remarkable implications of a bill that's going to cost significantly more than was promised. We know that there's 2,000 pages of legislation that are going to create close to 12,000 to 15,000 pages of regulation, with 1,000 references to what the Secretary shall or will do, all unknown quantities at this point in time, likely to create greater uncertainty and greater costs. Look, there were real opportunities to begin to do things to hold down the costs of health care by allowing there to be genuine competition across state lines that would compel the insurance companies, not reward them by virtue of the way this project does, giving them the in-state ability to have almost the franchises on the health care, to create genuine competition that would have driven down the health care costs. The idea that we'd be able to create pooling that would allow the small business person to go together with other kinds of small business persons and create the kind of an entity that would allow them again to compete for cost savings. The issue of tort reform that would allow there to be costs, something that Bryan Lentz has come out strongly against, the kind of thing that would allow there to be savings in the system so that defensive medicine would not have to be practiced.
Well, let me just start by saying that I hope the press took note that Pat Andrew, every job he's ever gotten has been as a result of one-party rule in Delaware County is now against one-party rule. The second thing I would say is that if you're going to Congress and your first mission is to repeal a bill that is going to give health insurance to sick people, to prevent insurance companies from discriminating against children because they're sick, and your first vote is to repeal it, then I don't want you to be my congressman, I'll tell you that right now. Pat Meehan has on his website, or at least the last time I had the misfortune of visiting it, he had on his website, that his first three priorities for health care were to end discrimination based on pre-existing conditions, to put a cap on out-of-pocket expenses, and to let children stay on their parents' insurance to age 26. Those three things were done by the bill that he wants to repeal. And by the way, those were important things because in America, until this law was passed, if you were sick, an insurance company could deny you insurance and tell you the reason was because you had an illness. In America, families went bankrupt that had paid their insurance premiums month after month, but they had the misfortune of having a family member get sick. That's over. So I disagree with his approach on health care. I disagree that the idea is to repeal it and to return it to the insurance companies. That's not the way we should go. Do we need to do more on cost? Of course we do. Medicare alone will consume our entire budget if we don't figure out a way to reduce the cost of providing care in America. The way to do that is to push for more reform in the payment system, reform that makes us look, more systems look like the Mayo Clinic and the Cleveland Clinic. It is not to go down and to join with the far right and to please the Tea Party and to repeal a law that is providing a benefit to thousands of the people that you want to represent.
Absolutely, I was in support of looking at the kinds of common sense things that people from both parties could have agreed on, that were never part of the genuine, no true dialogue that took place on this health care bill. But what did happen as a result of the legislation that was jammed through Congress on a one-party vote was the creation of a bill whose costs are going to significantly increase above what was promised. And when you look throughout the bill, you'll see numerous places in which promises were made, and the reality doesn't match what was said.
Just to follow, you mentioned one of the things that would help with cost is pooling. Well, this bill has pooling. Those are the state exchanges, and those state exchanges will go into effect in 2014. Is it a perfect bill? Far from it. I've never seen any legislature produce anything perfect. This bill has a lot of work to do on the cost containment, but you can't campaign and say that you want to end discrimination based on pre-existing conditions and do these other things that are popular. But out of the other side of your mouth, say that you want to repeal a historic change in the law that protects the most vulnerable in our society and prevents insurance companies. And that's who ran it before. Insurance companies ran our health system. He wants them to run it again.